speaker is Dr. Pradeep M.K. Nair. Question answer session will be there after completion of both these sessions. Dr. Pradeep M.K. Nair, presently he is Chief Medical Officer and Head Research and Development, Miracle Integrated Health Center, Pollachi, Coimbatore, Tamil Nadu. Previously, he was working as a Professor and Head Research at Sant Hridayaram Medical College of Naturopathy and Yogic Science for Women, Bhopal. He was the first head of the Research and Development Department of the National Institute of Naturopathy, Government of India. He has worked in various collaborative research projects with Institute of Repute. So his topic is Integrative Oncology, Advancement and Opportunities for Yoga and Naturopathy Medicine. Please proceed.
Thank you. Good morning, everyone. Thank you yesterday for organizers for inviting me for this particular thing. So my topic was recent advances in naturopathy. That's what I've been told. So of late, I am working in integrative oncology. So due to want of time, so I'll be just presenting what are the newer opportunities available in integrative oncology for a BNYS physician, integrating it with different stakeholders of oncology, how you can basically build on, not just for showing the symptomatic relief in cancer, but looking into the root cause and treating cancers and achieving complete remission in cancer, and it is possible and which is seen in our patients. So I'll just walk you through to different therapies which we'll be giving in our setting, which is Miracle Integrated Health Center in Pollachi. So if you see, look into the cancer and complementary and alternative medicine, the gold standard treatments are, as we all know, the chemotherapy, radiation, targeted therapies and surgeries are generally prescribed for oncology. But if you see, there is off late, there is an interest in the camp practices, especially yoga, naturopathy and traditional Chinese medicines plays a major role in oncology, especially integrative oncology. And however, if you see all the papers which is published on integrative oncology, they never speak about the remission of cancer. It is all centered around improving the anxiety, improving the different symptoms of cancer. So we basically look as a reductionist physician over there where the root cause of the disease is not addressed, and transiently we provide relief to the patient. And if you see most of our practice among naturopaths in our country, none of us basically take up cancer remission as a challenge due to the kind of pathology we know about cancer, and the moment somebody is diagnosed with cancer, we say that they are going to die. So that is the first thing which kills the people, which I have seen in our patient, which also there is, and we use that philosophy while we are treating a patient, which we'll be showing you. And so this was operated in 2018. This facility was inaugurated by our Honorable Vice President. And we have developed a integrative program where we use the best of naturopathy, yoga, homeopathy, as well as integrative medicine, as well as a part of modern medicine to treat our cancer patients, where we have set of doctors over there. So for that, first we need to understand, like yesterday in the keynote, it was being mentioned that we should look the therapies and the pathis, or the diseases, from the basic science perspective, not from the pathological perspective. So when you look, what is cancer? Cancer is neither a genetic origin, cancer is nor something which is need to be targeted aggressively and we need to kill the cancer cells. Cancer is same like a metabolic disorders like what we have, diabetes or hypertension. It shares a similar characteristics. But what is more in cancer is the abhinivesha, the fear of death and the fear of disease is very, very high, which itself will be giving a flight or fight response. So neither the inflammation is coming down in the patient, whatever treatments we are giving, the patient is always taking that with the therapy with the feeling that he is going to die some or the other day. If you go with a chemotherapy or a radiation therapy, they'll be said that you will be living for 3 months, you do whatever you want to do, and this is what we can do for increasing the survival time. So we decide how much a patient should live when we are, as doctors, we say based on the laboratory reports, we'll be saying that this is the end of the story. But when you look into cancer deeply, cancer is not a disease restricted to a particular organ, be it a cancer of liver or cancer of lungs, it is not restricted to that particular organ. When you look from the basic science perspective, cancer has these characteristics. The primary thing is mitochondrial dysfunction. You will not have the sufficient energy to reduce. That is why cancer patients feel a lot of fatigue. The second one, what we say is that excess amount of oxidative stress. The body is not functioning properly. There are free radicals circulating in the body. It is not being relieved every day. So, and we are overeating. Like with the therapy, we will be giving the food, which is sugary drink food. When there is glucose, excess amount of glucose will make the cancer cells survive, but our cells won't be getting the nutrition. The third one, the autophagy. When we are not allowing the autophagy mechanism, which requires 14 hours of non-feeding state. When you are not eating food for 14 hours, then only the autophagy will be stimulated inside the body. Less than that, the autophagy is minimal in the body. So, whenever we are not providing an opportunity for autophagy, that also will be leading to cancer progression, irrespective of whatever treatments we are doing. And following that, we have tissue hypoxia, because cancer cells survive in a non-oxygenated stage where normal cells require an oxygenation to survive. So what will the body will be doing when you have cancer? The cancer cells will reduce the oxygen supply to the good organs, and that is why the other organs get metastasis, and the metastasis is and what we should be doing, we should be restating the hypoxic stage, and we should be putting the body into excess oxygenation stage. And the gut dysbiosis, another one important component which we need to concentrate while we are looking into cancer patient. And the acidic nature of the body. When your pH is lesser than 6, the cancer cells only can survive in the acidic environment. It cannot survive in the alkaline environment. So our treatment should be directed to reinstating the alkalinity in the body. And finally, the sympathetic dominance, that is the flight or fight mechanism. Whenever the patient is being told that you are going to die, we do not know how is the survival chance, never we are bringing down the inflammation. And when there is a cytokine storm in the body, we can never expect a cancer patient to survive. He may or die in next other day. So these are the components which we target as a physician using different type of therapies at our setting. So how we can support? When we look into naturopathy, don't look naturopathy just like that. We are giving some diet and expect the patient to work. Patient will not work. Every patient is unique, and that is what is called unity of disease and unity of cure. Every cancer starts from a mental health trauma. We need to understand the patient's story so that we can start healing from the root cause. That is what called unity of disease. And when we start healing from the root cause, and also understanding what we study in yoga philosophy, the kleshas, what is hindering the progression of life, that is the abhinivesha, the fear of disease and fear of death. When we are removing these two components from the patient's mind, the patient comes back to the healing way. And what we use in our Miracle Integrated Health Center is, this is the protocol what we use, is a combination of oncothermia, which I'll be showing you, vitamin C therapies, ozone therapy, diet therapy, liposomal curcumin, vitamin D supplementation, probiotic therapy, CoQ enzyme therapy, sodium bicarbonate, which is baking soda, and other therapies which I'll be explaining one by one. And what is primary thing? Every patient on every day gets treated for 1.5 hours. He'll be getting counseling from the doctors, where we say that cancer is like diabetes. How people can live with diabetes, you can live with diabetes, and every one of us sitting over here is having some or the other cancer cells. Only thing, your internal biological systems are very much upregulated, and that is why you are not getting symptoms. So every one of us has cancer, and every one of us, if you take a PET scan, you all will have a cancer here or there in the body. So what is different in our people is to make patient understand how they can fight back, be resilient, and how the therapeutic order. And if you see the conventional practice, you are not discussed about what will happen when you take a chemotherapy or a radiation. But here we make them understand what we are basically doing for changing the things, and what we are trying to change in the person, and what is the role of a patient in the therapy, where in other therapies we won't be including the patient as a part of your therapeutic decision making. And this is one thing which we have changed on Miracle Health Center, and it worked wonders. And this is one of the therapy which use the heat as the therapy for targeting the cancer cells. It is called oncothermia, where this won't disturb the other cells, because the heat which is generated over here, it is a modulated heat frequency which will not elevate the heat shock proteins inside the body. It will be just directly targeting whichever cancer cells is there, and it is not there in India. It's very famous in other countries, but unfortunately it is not being used in India, and our center is on which we are having, and we are using this for every patient, where this is a modulated heat therapy where you can target any cancers at any part of the body. And then what we use, a high dose vitamin C therapy. Vitamin C is something which is having an anti-cancerous effect, but the diet vitamin C, what you're taking from an amla or a nimbu, it won't be having sufficient. We need high dose vitamin C. When the dose of vitamin C is very, very high, we give 1 gram vitamin C on an average per body kg weight. So patients will be taking up to 90 grams of vitamin C across a week. Every week we'll be providing 90 grams of vitamin C for our patients, which basically stimulates the entire body, it upregulates the scavenging mechanism of cancer, because in the presence of ascorbic acid, cancer cells cannot survive. And these knowledge come from looking cancer from a basic science perspective, not from a pathologic perspective. And then we have ozone therapy, as I told, the tissue hypoxia and the need of the HB reduction is one of the problem. Anemia is another problem which we face in our cancer patients, and it's very challenging when you just look at the cancer patient, the amount of mental burden as well as the physical burden they carry to the clinic. So ozone therapy, we give direct oxygenation to our patients, and it increases the oxygenated status in the body, and ozone is one of the known antioxidant. When you say, I have told that the antioxidant potential will be reduced when you are having cancer. And this ozone therapy in different forms, either through injectable ozone or through rectal ozone, vaginal ozone, and ear ozones, different type of ozone therapy, and which is very well integrated. Now, National Institute of Naturopathy is also conducting programs on ozone, which you can benefit out of it. And we remove complete maida products, sugar products, white rice from their diet. Millet-based food is something which we prescribe to our patients, because millet is only one thing, because we do not want to raise the glycemic load. And every patient of ours, 15 minutes, okay. Every patient of ours basically go into something of sort 14 hours of fasting. 14 to 16 hours of fasting they will be undergoing. Every patient, irrespective of their emaciation status, 16 hours of non-eating hours is practiced at our clinic. Only 8 hours they eat, and that to 2 meals we provide to our patients. And with that, the intermittent fasting or the time-restricted feeding activity is also been there. And also curcumin, by a liposomal mechanism, we will be making oral curcumin, and they will be taking the oral curcumin 15 ml per day. And there is vitamin D, which is depleted in almost every condition, including cancer, and so cancer don't have to be treated differently. So vitamin D, we look into the parathyroid hormone and ionized calcium in the body and supplement, and we maintain the vitamin D status of our patient of 80 nanogram per ml. That is the minimum requirement we will be maintaining in our patient. And then, of course, probiotic supplementation. We give natural probiotics, that is overnight prescribed. The millets will be poured into water overnight, and the next day they'll be taking, as well as supplementation also will be provided. And for mitochondrial dysregulation, we give CoQ enzyme. This is ubiquitin, which is one of the very brilliant thing which can convert, there will be a lot of ADP production which is not converted to ATP, and that can be relieved by supplementing CoQ10 enzyme. And sodium bicarbonate, baking soda without aluminum. You can wash the cancers with baking soda because it contains lot of alkalinity. The acidic nature of the body can be changed by using sodium bicarbonate drinking, and for our cancer wounds, we make them wash with sodium bicarbonate, baking soda, which is the home remedy. And then we have hyperbaric oxygen therapy, again a modified version of ozone therapy, where we give excess amount of oxygen. When the patient's oxygen level is very, very depleted, at that point of time we will be using. And for kind of anxiety, depression, suicidal tendency in cancer patients, we use medical cannabis. The cannabis oil, marijuana, we will be using in a different form, where we will be trying and reducing. Cancer pain is very intolerable. Even morphine cannot respond to cancer at times. So at that point of time, we use medical cannabis for our patients. It in oil form, sublingual we will be giving, and it will be giving them good sleep, reduction in their anxiety, depression and all. And coffee enema is one thing which we do at our place, which basically it's a liver detox. It is called liver flush in our setting. So we use this for improving the antioxidant status in the liver, which is one of the fundamental organ for detoxing. And sun exposure, every patient of our, irrespective of vitamin D supplementation, we will be giving sun exposure 10 to 20 minutes every day. It improves their mental health status other than vitamin D therapy. And yoga therapies, as you know, it's one of the integral part of integrative oncology. And yoga is not just for anxiety and depression, it can change the internal mechanisms in the body also. So we don't give yoga just to say that it is going to improve your anxiety and depression. We say that it is going to change the internal milieu. And acupuncture, at times we use for pain reduction in our patients, along with the other therapies which I have and we use a lot of magnetotherapy. This is pulse electromagnetic field which we use in our people. It gives wonderful results. It is about, like somebody was telling yesterday, these therapies, unless you use and find what it is, you won't understand what is the magnanimity that therapies can do. So this is magnetotherapy, which is an advanced version of magnetotherapy. And other than that, we use sauna with far infrared rays, as well as, and that is a modified form of chromotherapy, which is called hydrosun therapy, which uses 7 colors, which has both spiritual healing and the properties of color. The hydrosun therapy, as well as near infrared, very good for breast cancer, and far infrared therapies, which is there available everywhere, and we use this extensively in our patients as a detoxification. And these are some cases which we have treated. And if you see the bladder cancer before and after, after our therapies, the entire bladder cancer got cleared in our patient, and documentation is very, very important while we are doing. And this is another one case of lung cancer with skeletal metastasis. Before and after, you can see the entire cancer spread across the body, and there is a complete remission of the cancer. And it is not like that the patient take this, got remission and go back. They are still with us 4 years, 5 years, who have just given days for 15 days, 30 days. They are with us, they come, take a vitamin C shot in between as a maintenance therapy and go back. So, and this is some breast cancer. We do not encourage people to use PET because it contains itself a radiation. So we use something called thermal scan. And people, somebody, they will be coming with PET scan is something which is ultimatum. So they will go for PET. Otherwise, we will be using thermal scan, which shows hyperthermic patches when there are cancers. And this is before and after result of some breast cancer patient. So every patient can be treated. Don't look into the symptoms. Symptom is very transient, and we can definitely reach the root cause and address the cancer. And cancer is just like a metabolic disorder. And thank you so much. Fight the tumor, but nourish the patient. Thank you.
Thank you, Dr. Pradeep M.K. Nair. Please have a seat. We will move for the question session. Audience, if there are any questions, please you can ask. For both the speakers. Your first speaker spoke about naturopathic medicine and yoga in spine management, and further integrative oncology, naturopathic medicine, how we can use as an integrative oncology setup.
What is the percentage of improvement in cases of cancer, and since how long this hospital is going on?
So it's 5 years, sir, now. So the percentage is 70 to 80%. All of the patients get remission and increased survival time than what these others have told. And so it's like the fear of cancer will be long lasting for at least 3 years. So every pain they get, they may relate to cancer pain. So that is one challenge we every time try and get overcome. But most of our patients, like around 70 to 80% of patients are fine.
So approximately how many patients were treated so far?
So more than 200 to 50 patients have been there across, because we are a small setting with 30 bedded hospital, and each patient may be staying for 3 months, and also we really cannot accommodate a lot of people.
Good. Thank you.
Please pass on the mic, please. Yeah. Couple of more questions.
Very nice lecture, sir, for about the pain management. Is there any cure for the lestis, or only for sciatica and or intervertebral disc problems?
Yeah.
Another thing is, there are different types of heel walkings, and what are the U method following?